and welcome to the Doula channel. I'm Renee Corner, and today I have with me Sarah Kessler, and we are going to be talking about placenta encapsulation. I'm sure if you are pregnant or thinking about becoming pregnant or have had a baby, you've heard about placenta encapsulation. Now, Sarah Kessler is a placenta encapsulator, so she's going to be able to give us some of her expert information on the benefits of placenta encapsulation and how that might affect you and your postpartum period. So welcome, Sarah.
Hi, thank you.
Glad to have you.
Glad to be here.
All right, so let's talk about the basics. What is placenta encapsulation?
So placenta encapsulation is a method of ingesting the placenta so that way you can reap some of the benefits postpartum for healing and hormonal balancing.
Okay, so when you say ingest the placenta, what does that mean?
That means you are technically eating your placenta.
Okay, so as a doula,
Yes.
I've seen it done many different ways because we know the benefits of ingesting the placenta. What's the most common way that people will ingest their placenta nowadays?
The most popular way is traditional Chinese medicine method. So how that's done is the placenta is gently rinsed and then steamed lightly on both sides. Then it's sliced very thin and placed in a dehydrator, kind of like a regular old food dehydrator, nothing special.
Okay.
It dehydrates slowly, overnight usually, and the next day the encapsulator will take the dried out brittle strips of placenta, grind it into a fine powder, and encapsulate that fine powder into a capsule. So by the time the client gets the capsule, when you look at it, if no one told you it was placenta in it, you'd have no idea. It looks just like a regular vitamin.
Okay, so that's the most common way because people can probably handle just taking a vitamin.
Exactly.
Versus maybe cutting the strips themselves.
Exactly.
And putting it into a smoothie.
Some people do smoothies. Other cultures will even make a stew or a soup even out of it.
Especially those that need the hot foods or liquids afterwards. Okay.
Exactly.
Now, what are the benefits of doing this placenta encapsulation?
So, during pregnancy, labor, and birth, the mom goes through a lot of changes hormonally. These hormones all get flushed through the placenta, and the placenta retains a lot of them. So, the number one benefit of encapsulating your placenta and taking your placenta capsules is balancing out hormones. So that way in the postpartum period, when you're healing, you can more gradually even out your hormonal fluctuations as opposed to having major peaks and valleys.
Okay, so let's be fair. There are some naysayers out there.
Yes, there definitely are.
Okay, and some are saying that there's no scientific backing to ingesting your placenta. What has your research proved in the contrary or in agreement with?
There haven't been a lot of major studies done on humans and the ingestion of placenta by humans. Okay. There have been more studies on rats and other animals that have shown the hormonal benefits of it, as well as balancing out your iron levels and things like that for the postpartum period.
Because there's a lot of blood loss during childbirth in some
Exactly.
cases.
Exactly.
Is it fair to say we are the only animals that don't eat their placenta?
Humans are the only mammals that do not eat their placenta.
Okay.
So, yes, that's true.
Because, I mean, I've been around. I was raised on a farm, so obviously the pigs, the cows, the horses would ingest their placenta. I've been present when there's been a home birth of kittens or dogs, and the same thing occurs, right?
Yeah, definitely. Okay. And the other thing about that is there's also research to look into why certain animals ingest their placentas. Often people say, well, animals will ingest their placentas for the safety of their babies and things like that out in nature. But they have done the research and they've seen that's not the only reason, because even animals that are in captivity or that are safe or don't have major predators are also eating their placentas.
That's good to know.
Yeah.
Now, you talk about the hormone benefits.
Yes.
Okay, so we talked a little bit about the bleeding that occurs during childbirth. And then obviously the fatigue, and then, breast milk production seems to be the main benefits. Talk to me more about those hormones.
So one of the major hormones in the placenta is oxytocin.
Okay.
So when women are in labor and they give birth, they have a large release of oxytocin, which means after the birth, they will have a major drop in oxytocin. Oxytocin is the love drug, the hormone that gives us those warms and fuzzies in our tummies. So if we have a drop in that hormone, we are more likely to experience what are known as the baby blues. The baby blues is when you feel down and upset and teary, and that's different than postpartum depression. When ingesting the placenta and putting back that oxytocin that's in the placenta, your own natural ratio of hormones back into, it helps even out your hormonal stages, so that way you don't have the strong effects of the baby blues.
Okay.
Yeah.
Is there ever a time that you would not recommend doing placenta encapsulation?
I do not recommend placenta encapsulation if the placenta is not cared for properly immediately after the birth. You still need to treat the placenta as if it is raw meat. I also do not encourage placenta encapsulation if the mom developed a fever or an infection during the labor and birth process, because then the placenta may not be healthy as well. A few other times when you might not be able to encapsulate your placenta is if the placenta went to pathology in a hospital setting and it's treated with chemicals, because you don't want to ingest those chemicals.
Yeah.
Generally speaking, health-wise, there aren't any major reasons why you could not do your own placenta.
Well, that brings up a point. Has anyone ever ingested someone else's placenta?
I have heard of it, yes. It's not necessarily something that I recommend, because you don't know, your own natural blood is in there and your own body stuff is in there, so you don't know what other people have or don't have. So it could be a family member that you trust, and I've heard of mothers taking the placenta capsules of a sister or things like that. But generally speaking, it's perfectly calibrated for the new mom, and so it's best for her to get all those benefits.
Yeah, she's the one recovering, right?
Yeah.
It also, as you were speaking, it brought up a few other points. I know that you are very careful with the bloodborne pathogens as you process this encapsulation. So what are some of the extra steps that you take to ensure the safety of that placenta before returning it to the mom?
Well, one of the number one policies that I follow by is I only have a one placenta in at a time policy. So I only have within my possession one placenta at a time.
Okay.
There's no way I can ever accidentally give the wrong placenta to the wrong client, because I will not even pick up a new placenta until the first one I have is back to its original owner. That, as well as I make sure that my processing area is perfectly sterile and all of my equipment is used only for placenta encapsulation and sterilized in between each process.
That's good to know. Have you ever been asked to process a placenta at the client's home?
Yes, and that's actually a really good idea, because when we are in the client's home, the client's germs are already there. But the problem with that is sometimes the mom's just getting home from having a baby, and maybe she has dishes in her sink, or her kitchen's not all picked up because, I don't know, she went into labor and had to go have a baby. So the last thing you want is for a client to come home and have to feel as though she needs to clean her kitchen.
Okay.
Many do like the option, though, of being able to watch what's happening, and so they know what's in their capsules, and that's a good way of doing it, too.
So would you go to their house, set up the dehydrator, and let that go for 12, 24, or however many hours it needs, and then go back and do the grinding?
Yes.
Okay.
So it would be a 2-visit process when done at the client's home.
Okay, that makes perfect sense. You and I have talked a little bit about surrogacy as well, because that's kind of a topic that's near and dear to us. Is there ever a time where the surrogate or birthing woman may or may not want to do encapsulation?
Yes, as a surrogate, it could be really helpful because of the hormonal fluctuations that the birthing woman still goes through, even though she doesn't have the baby.
Mm-hmm.
Also, sometimes surrogates will want to pump breast milk after and donate that breast milk to either the intended parents or other babies that may need the breast milk. In that case, encapsulating your placenta can also help give you a boost of milk supply, which is really helpful when you're exclusively pumping.
So that could also be beneficial to a new mom too, not outside of surrogacy that is maybe having breast milk issues.
Yes, definitely. That's another huge advantage of encapsulating your placenta.
And you mentioned that it helps with fatigue because of the blood loss, so restoring some of the things that may have been lost during childbirth and then now breast milk production. In surrogacy in particular, you and I talked a little bit before. You said maybe some of the surrogates wouldn't want to do encapsulation because the placenta actually contains fetal cells.
Yes.
Okay.
So when a surrogate is what's called a gestational carrier and she has no actual biological connection to the baby, the placenta is developed from the embryo that is transferred into her. So the cells, there are fetal cells within that placenta. Some surrogates are not comfortable with ingesting the placenta for that reason.
Because it's a donated embryo.
Exactly.
Okay. Or egg, or however the process occurred. Okay. So that makes sense. But they could certainly benefit recovery-wise, right?
Yes. They can definitely benefit from the hormonal balancing effects.
So there's that, and then the milk production if they were planning to pump and donate.
Exactly.
The other thing that I think about is payment.
Yes.
Right? Because a lot of people want to know how much does it cost to have your placenta encapsulated.
In Southern California, where I'm currently located, it ranges anywhere from about $200 to $300. Some encapsulators include prints and get artistic and other keepsakes with it, but the general average is between $200 and $300.
Okay. And how many capsules might that yield?
It depends on the size of the placenta. I've gotten as little as 80 capsules before out of one placenta and as many as 200 capsules out of one placenta. So my general average is about 120, 125 per placenta.
And about how long would that last?
It depends on the mother's needs. I often tell my clients the recommended or suggested dosage is about 2 to 3 capsules 3 times a day for the first 2 weeks. So that's 6 to 9 capsules a day in the first 2 weeks. But some moms will feel as though they don't need that much. So if I always say to listen to your body. What is your body telling you? What are your needs? Mm-hmm. If you find out that your evening capsules are giving you too much energy and you can't get some rest when you really need to recover from birth, then taper off. Don't take as many. If you find you're getting too much of a milk supply, and you're having a really fast letdown and you're having issues establishing your milk supply, then you might also want to taper off and not have as many.
And these are kept in the freezer?
Yes. Moisture is their worst enemy. Okay. Keeping them in the freezer, tucked away, helps prevent moisture getting to the capsules.
So let's say she had enough capsules and she took them for like the first 2 to 3 weeks, and then she had some remainder pills. Would she then put those in the freezer? And when would be another good time that she might pull those back out and use them?
Yes, she definitely would want to store them in the freezer so that way they're good for a long period of time. And another time when she might feel the need to take the capsules is when her menstrual cycle returns after so many months postpartum. That's a tricky hormonal fluctuation period. Mm-hmm. Also, sometimes moms, around the 6-month mark postpartum and the 9-month postpartum, there's a fluctuation of hormones that can be helped by taking the placenta capsules.
Yeah, they can remedy that for sure. Are there any downsides to taking the placenta encapsulation?
I haven't found any.
What about to those that say it's kind of a placebo effect?
If it's a placebo effect and it works, then who cares?
there's nothing to lose. I mean,
right? If it works, there's really nothing to lose. If you have your placenta encapsulated by a professional encapsulator who's done it correctly and the placenta was cared for correctly prior to the encapsulation process, then mom shouldn't get sick from them if they're stored properly. So then there truly is no downside.
What about taste? Does it have a particular taste?
it can have a taste or a smell. And it kind of tastes and smells like liver, cooked liver.
Okay.
Not everyone is a fan. Some encapsulators offer capsules that are flavored capsules like strawberry or mint or something like that. Another suggestion I give to my clients is to take a sip of your drink or beverage first, then throw the capsule in your mouth and swallow it. Don't let it dissolve on your tongue.
What about tinctures? I've heard this is something that a lot of clients would request as well because they might have that available for a longer period of time.
Yes. So tinctures, there's what are called tinctures as well as mother essences.
Okay.
So tinctures usually have a chunk of raw placenta in a high proof alcohol. I use Everclear, it's 151 proof, high grade alcohol. What that does is that piece of placenta steeps in the alcohol so that hormonal and the balancing effects are then in this liquid. You would then take the liquid and give drops of that either directly into a drink. Some people put it directly under their tongue, though it might not taste very good. This has the same hormonal balancing effects as the capsules, and its shelf life is longer. So this would be stored in a medicine cabinet or a cupboard, and in a cool, dark place, and it can last for eternity.
So you put the placenta in the alcohol, and then periodically they have to shake it.
Mm-hmm.
How long after can they start using that?
It usually needs to steep for about 6 weeks.
Okay.
And after that point, you would swirl it prior to using it, and it would be good.
Okay.
This can be held onto all the way from menopause. So if a woman's starting to have menopausal symptoms and she still has her placenta tincture, she can use this to help with that.
That would have been good to know a few years ago. What's the difference between the tincture and the essence?
In an essence, often the placenta piece itself is strained out.
Oh, that makes sense. Is there anything else families need to know when they're considering placenta encapsulation?
Ask whoever you are talking to about encapsulating. Ask if she's been trained. Ask if she's taken any sort of training on proper sanitation and the process that she goes through for that proper sanitation. That's very, very important. A lot of people can learn how to do the process through YouTube and things like that, but then they're not taught on how to properly do it in a clean manner for everyone's health and safety.
Many can get certified to become a certified placenta encapsulator.
Correct. There are several certifying organizations now. At one time, there was only one organization, but it is becoming more popular and more organizations are offering a certification process.
So that might be a question they ask, are you certified to do this?
Exactly.
And if so, who are your credentials through?
However, with it being a newer trend in getting certified in, there are very capable encapsulators that may have been doing this for 15 years, and then that would be something that may make you feel more comfortable if she's not certified.
If this is your first time watching the Doula channel, just so you know, again, I don't edit these videos at all. They're raw. What you see is what you get. So the telephone ringing in the back, my apologies, but sometimes that happens. So hopefully it wasn't too much of a distraction. Sarah, it's been a pleasure having you. I thank you for bringing your expertise on the subject to the Doula channel. Her website will be listed below. So if you're in Southern California, certainly seek out Sarah Kessler. She's one of the best. I know I personally refer my clients to her as well because I know she does an amazing job and she's very thorough and very professional about it. So if you have any other questions, get in touch with Sarah Kessler, and I hope you have a great day. Thanks for coming.